Want to learn how to make the most of your doctor's appointments and ensure every important detail gets discussed? Let me show you a simple but powerful tool that transformed my medical visits. Before going to medical school, I thought doctors had instant access to all of our medical records, like some master file that followed us everywhere. But after years of practicing medicine, chasing down labs from out of state clinics, or trying to piece together histories from medical systems that no longer exist, I now know how fragmented and error prone the process really is. Keeping a complete and organized medical record in one place, that falls on the patient more often than you'd think, especially if you move from state to state. What changed everything for me, both as a doctor and a patient with multiple chronic illnesses, was creating my own medical history record. And in this video, I'm going to show you how it can change your healthcare experience as well. Here's the truth. Medical records in the United States are often incomplete, scattered across different provider systems, and can have errors. There is a study done by the Office of the National Coordinator for Health Information Technology, which, yes, that's a government department that actually exists. They found that about 1 in 10 people who accessed their electronic medical record spotted a mistake. And many of those errors were serious, like incorrect diagnoses or incorrect medications. They do actually have a website I found that most of my patients don't know exists, which walks you through what the laws are surrounding your medical care and your right to access your medical records, how you can request your medical records from your provider, and how you can correct any errors you might find in those medical records. You can go to healthit.gov slash how to get your health records to learn more. I've put the link in the description box below. When you live with chronic illnesses, rare conditions, or even just multiple providers, the burden of connecting the dots oftentimes falls on you and your family medicine provider. But if you're changing family medicine providers, or you have a difficult time getting in to see one consistently, the burden can fall on you to keep track of everything that's going on across all of the different specialists. That's why I started building my own medical history, a document that outlined my diagnoses, my surgeries, any major tests I'd had, medication changes, and flare ups. As both a physician and a patient, this gave me a whole new level of clarity. There was a point where I needed medication before an emergency surgery, and I didn't get it. The provider didn't have my full history, didn't believe me when I said I had Addison's disease, and all of my records were located out of state. I wasn't in a position to prove it quickly. The result, a much harder recovery than I should have had. Just in case you were wondering if medical providers are also having difficulty getting other medical providers to believe us about our medical conditions, the answer, unfortunately, is yes. Looking back, I wish I'd had my labs printed, my diagnoses outlined, and my story documented in a way that was easy for me to share. That experience is what pushed me to finally build my own medical history record. And it hasn't just helped me since. It's changed the way that I practice medicine too, because helping patients tell their story more clearly is one of the most powerful things I think we can do. And you don't need to be tech savvy. Start simple. Use a notebook, a Word document, the Notes app on your phone, perhaps a second brain like Notion, or you can use my free medical history tracker that I've created for this purpose. You want to begin with major milestones. First, your first diagnosis or your first surgery, any key symptoms, when they started, how old you were, what year it was, and then add in medications, what's been started and stopped, if you had any side effects or reactions to it, and why they were prescribed. You want to include major lab results, imaging, hospitalizations, and any major flare ups that affected your life. Don't worry if you can't remember everything. Just start where you are. You can always build backwards as you remember more. Make sure to bring this into your appointments. Keep a printed copy or have it saved on your phone and update it regularly, especially if something changes. This one tool can help new medical providers catch up faster with what's going on with your health. It can prevent redundant and unnecessary medical testing and billing, and it can help support disability claims, second opinions, and specialty referrals. It can also help providers, especially if you're traveling or out of state, to catch up and understand what's going on when they don't have access to your regular medical records. You don't have to memorize your whole health history, but you do need a way to tell your story and tell it accurately. Having a medical history timeline can give you confidence, clarity, and most importantly, better care. You can download the free tracker I made for you at drgoodwinmd.com. The link is in the description. Or if you want a printed version that you can start using right away, there is a 90-day journal that includes the same pages available on Amazon, and I've linked that below as well. If this helped you feel even a little bit more prepared for your next appointment, hit that subscribe button because you deserve to be heard. So let's make sure you are.